According to the World Health Organization, the population aged 60 and over will be double between 2015 and 2050. In Spain, one of the every 3 people will be over 65 years old by 2050. You can imagine that the population aging is a determinant factor in the rise of the waiting list. In fact, Spain reached a historic record by the end of the 2023, when the average waiting time was 128 days in the last part of 2023. Moreover, a severe lack of healthcare workers is expected, with a deficit of employees of 10 million by 2030. So, with this scenario, the question and the challenge is how the Spanish healthcare system will address this situation with a static budget, a collapsed system, and a growing lack of human resources. Well, in Spain, there are more than 22 community pharmacies. There is one pharmacy for every 2,000 inhabitants in our country. You know that pharmacies play a fundamental role in providing basic health. They provide access to medicines and health products with expert help. They also give advice, educate, and on medicine use. And also, they monitor your treatments. So, you know that many people go to the pharmacies first when they are sick, because they are easy to reach and more familiar than other places. Some pharmacies offer health services to patients, but these services aren't integrated into the healthcare system. For example, if you go to a pharmacist and you check your pressure, your doctor doesn't know the results of this test, and vice versa. The pharmacist only know information about your medication, but anything more. Additionally, these services are often unpaid because they are not regulated, so the cost depends on the pharmacy. Lastly, pharmacies can hire a nutritionist, a physiotherapist, a nurse, so it's very difficult to offer that services in the pharmacies. But the pharmacies have a capacity to be a low complexity center. In fact, during the COVID pandemic, pharmacies became an essential places for healthcare. For example, during the COVID, a new way to pick up the medicines of the hospital started. Before the pandemic, when a patient need to pick up a medicine, had to go to the hospital. But when the hospitals were busy, these patients could to go to the pharmacy to pick up these medicines. On the other hand, some communities allow antigen testing to be conducted in the pharmacist. And furthermore, pharmacies have been involved in notifying positive results for self-test for the Department of Health. Maybe these services seem normal and seem logical. But before the pandemic, pharmacies didn't dispense this kind of medicines or do any kind of diagnostic test. So, this proactive approach has alleviated pressure on primary centers and facilitated the public health education. some pharmacies have still provide this kind of services. So I think that we learn about this situation and we can learn more about another countries. For example, in United Kingdom, the Pharmacy First program allows pharmacies to prescribe and dispense medicines for minor conditions. Since 2007, pharmacies in Portugal can administer vaccines, and since 2008, they can offer nutrition consultants. In Italy, the pharmacy acts as a healthcare reference for the government and for the patients. Some services include blood tests, urine tests, cardiac activity, respiratory capacity tests, as well as pharmacy. In Italy, a patient can get an electrocardiogram at the pharmacy and the results are sent to their doctor. That's amazing and that's incredible in Spain. And other countries like Australia, Canada, and Netherlands have integrated pharmacies into their primary care system. These successful examples show us how pharmacies can be a healthcare system. So, my proposal is integrating pharmacies into the Spanish healthcare system, allowing them to dispense medication without a prescription and offer services of healthcare to the patients, such as other countries like Portugal, Italy, or United Kingdom. Taking advantage of the functions of pharmacy professionals can make the healthcare system more accessible, reduce pressure on hospitals, and also promote long-term cost savings. So, a better healthcare system in Spain is possible. And if you've been thinking for a while, yes, I'm a pharmacist. Thank you.